XHANCE is a prescription medicine used for the treatment of nasal polyps in adults. Please see the important safety information at the end of this video. David's story, a patient's perspective.
My name is David. I'm 35 years old. I live with my wife. We've been together 16 years. We were college sweethearts, and we have a daughter who's about 18 months now. My family has always had issues with congestion, so I thought maybe it was just our DNA. But at my annual physical, the doctor would say, "You sound congested," and I would just answer, "Yeah, that's how I always sound." I tried all kinds of nasal sprays for my congestion, but none seemed to work. To me, the most frustrating thing was just on a daily basis, I wasn't able to kind of enjoy the use of an important sense, which is smell. And to me, that's so important because I love food, I love cooking and drinking. And what's funny is my mom always says, even from a young age, I just love to smell things. And it sounds weird, but like the smell of a good hand soap, or my dad taught me that, when he reads books, he'll open it and smell the pages. After having my symptoms for so long, I kind of just accepted them as a fact of life. But one night, I was having dinner with a friend who knew about my congestion and insisted that I should go see his ear, nose, and throat specialist. It was really nice to have a recommendation from someone I trusted who basically told me, "Hey, I sounded like you," and I was able to address it. At my very first appointment, the ENT diagnosed me with something that I'd never heard of before, nasal polyps. The doctor used an instrument to show me my polyps on the video screen. I remember thinking, if this is my nose, no wonder I can't smell. When my doctor recommended surgery, it wasn't something I was excited about at all. Surgery is expensive, and money was a concern because insurance only covers a portion of the cost. My doctor told me surgery may not be curative. After my surgery and after I healed, we discussed options for long-term management of my nasal polyps, and that's when he prescribed XHANCE. XHANCE looked different, and when my doctor explained how XHANCE worked, it was really compelling. Because of the way it's administered, the medicine has the potential to get to where the nasal polyps originate. He showed me how you use your own breath to get the medicine into your nasal passage. On a daily basis, I can tell the difference in my symptoms. With reduced congestion, I can now appreciate the scent of lemon or lavender hand soap. Now I can enjoy the benefits of a $35 candle, a cocktail, my food, my cologne. It's the small things that most people take for granted. It's great to be able to talk to others and know that I don't sound congested. It's great to lay my head down at night and be able to keep my mouth closed when I go to sleep. Sometimes I think if I had treated my nasal polyps before, I probably would have started enjoying these things a lot sooner.
Important safety information. Do not use XHANCE if you are allergic to fluticasone, propionate, or any of the ingredients in XHANCE. Get emergency medical care if you get any of these signs of a serious allergic reaction: rash, hives, swelling of your face, mouth, and tongue, breathing problems, or low blood pressure. Tell your healthcare provider about all your medical conditions and medications that you take. It is especially important to mention if you take antifungal or anti-HIV medicines, as they may interact with XHANCE. XHANCE can cause nasal problems such as nosebleeds, crusting, sores, hole in the septum, and slow wound healing. XHANCE can cause eye problems, including glaucoma and cataracts. You should have regular eye exams when using XHANCE. XHANCE may increase the risk of infections and make certain infections worse. Avoid contact with people who have a contagious disease such as chickenpox or measles while using XHANCE. XHANCE can cause reduced production of steroid hormones by your adrenal gland, resulting in tiredness, weakness, nausea and vomiting, and low blood pressure. XHANCE can weaken bones, osteoporosis. Other side effects may include redness, pain, or swelling of the nose or throat, thrush, fungal infection of the nose and throat, nasal congestion, sinus infection, and headache. These are not all the side effects of XHANCE. Call your doctor for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088. Before using XHANCE, carefully read the FDA-approved patient information and instructions for use.